Hello, internet people. It's me, look, Roger Kerry from the University of Nottingham. And I'm going to tell you something now. I'm going to tell you about the Guidelines Challenge Conference being organised by CauseHealth, who you may know about, but I'm going to put a link below anyway. So this is a conference that you should come to, and I'm going to tell you why you should come to it. And it's in October in Oxford at the Oxford Spires Hotel, which is really nice apparently, and Oxford's really cool anyway, so you should go just to see Oxford. But the conference is really good, and we've put together 2 days of information about clinical guidelines, but so that might not sound that interesting just at that level, but what this falls off the back of is the big project that is interested in scientific research and how big population data relates to individual clinical decisions, which is the part of the whole sort of core of what CauseHealth is about. But it's also a concern of other people like NICE and guideline developers. What sort of information should inform guidelines, and how should that information be interpreted and used in terms of policy making and individual clinical decision making. So it's the conference is attractive to a wide range of people, including of course clinicians who make clinical decisions on a daily basis. How should those decisions be informed in an age of evidence-based medicine and evidence-based practice? So big emphasis on that, of course. But on the other side of it, what sort of research programs and research methods should be used to generate the sort of scientific information that should input into guidelines, and big discussion around that. So as well as clinicians, there's a big philosophical and sociological emphasis to this in terms of knowledge, epistemology, and how society and people interpret knowledge, or how they should do. So, and of course this is really useful and relevant for patients, and that would be great to have some patients come along to the conference as well and join in the discussion. Got a range of speakers that is just excellent. 4 keynotes. Brian Broom from New Zealand, immunologist from New Zealand. Nancy Cartwright, philosopher of science from San Diego and Durham. Our own Trish Greenhalgh, who you know all about, medical academic, GP, generally ACE type person, and Mike Kelly from Cambridge, who's a medical sociologist and epidemiologist and public health expert, and they are going to be delivering their keynote lectures. And then we've got a range of loads of other great people scheduled to talk and discuss and thrash this issue out about what is the future of clinical guidelines. So if you are a clinician, if you are a critical thinker, if you are a philosopher, if you are a social scientist and sociologist, and if you're a patient, and if you are anybody with an interest in how clinical decisions should be made and how clinical guidelines should be informed, you should come along to this. So lots of links below in the comment section to get registered, and we'll see you in October in Oxford.